Hi everyone, welcome to the class of Kidscovery. Myself Dr. Parv, and we are discussing pediatrics. The topic of discussion in the section of Pediatric Orthopedics and Rheumatology is pediatric fracture. Now there are a lot of pediatric fractures which are indeed very important, but if you ask me one out of all these fractures, that is going to be the Greenstick fracture. But let's quickly discuss all the three fractures: the Torus fracture, the Greenstick fracture and the toddler's fracture. So before we discuss about the fractures in detail, I just want you to focus yourself on this picture. Can you see this is the axial force which is acting on these structures? This is the axial force which is being applied on this bone, and this is responsible for the Torus fracture of the head of the radius. Okay, so if some axial force is coming, it is going to have a fracture like this, and this is called as Torus fracture. But remember, if some bending force is coming, okay, if some bending force is coming, have you seen the police, not police but the security guards, they just bend the hand like this and they'll hit on this. So this is a bending fracture, which is a bending force which is going to come and is going to bang on the head of the radius. So that bending force is going to cause which fracture? That is responsible for causing the Greenstick fracture. That's going to be the Greenstick fracture of the radius. Okay, so Greenstick fracture and the Torus fracture I have told you. So what happens basically, the buccal fracture, there's an axial force which is coming, axial compression which is coming, and that is causing the buckling. See what happens now, there will be buckling of the one cortex without the break in the opposite side. So of course break is not going to happen, but there will be buckling which will be there. Can you see this? This is something which is called as buckling. Okay, this is something which is called as buckling. So there will be buckling which is going to happen, but of course there is no break which is going to come in the bone, because pediatric bones are super flexible, super plastic. Okay, so there will be buckling which will be there in the Torus fracture. Okay, of course. And what about the Greenstick fracture? There will be bend, bone is going to bend and crack on one side. So it's an incomplete fracture because the other side remains intact with the plastic deformation. Okay, the other side, see this side is getting bend, this side is getting crack also, but that's an incomplete fracture because there is no complete break which is going to occur. Both of these pediatric, the Greenstick fracture, the Torus fracture, both of them are seen in children, and here it was axial compression, here it is the bending force which is going to be there. So what is the common site? So common site is actually the distal fracture, distal radius in case of buccal or Torus fracture, whereas it is the mid diaphysis in the case of Greenstick fracture. What will be X-ray finding? Of course, you will see a cortical buckling which will be there, and of course there is no fracture line which is going to be there. And Torus, why it is called as Torus? So basically it looks like a raised thing. So raised in Greek is called as Torus only. Of course there will be mild pain, swelling, tenderness, all these things are going to be there. In both Greenstick also there is pain, swelling, and which is going to be there. But yeah, of course deformity is something which is seen in the, so basically there is a deformity which is going to be there. Okay, there's a deformity which is going to be there in the Greenstick fracture, but there's no deformity which is seen in the buccal fracture on the Torus fracture. So what you have to do, see the deformity is there in Greenstick fracture. So what we have to do, we have to just straighten the bone, we have to just join the two ends, and we do a closed reduction. There is no need to open the cavity, but closed reduction is something which is required in Greenstick fracture. Cast immobilization is required for 2 to 3 weeks, whereas simple immobilization is required in case of your Torus fracture. Just simple immobilization, whereas cast immobilization, closed reduction, CC is something which is required in G. So C and G are very similar looking, so I just use it as a mnemonic that it is required in the Greenstick fracture. Coming on to toddler, as the name suggests, it is seen in the toddler. So what happens? It's actually a non-displaced spiral fracture of the distal tibial metaphysis. So if this is tibia, this is epiphysis, this is going to be the area of the metaphysis. So there is going to be which type of fracture? There is going to be a spiral fracture. which is non-displaced. So non-displaced spiral fracture of the distal tibial metaphysis. Okay, so very simple, very easy. So distal has got T word, tibial has got T word, toddler has got this T word, and this T, twisting injury. Okay, so it's going to be what? They're going to be twisting injury on a minor fall, which is actually unwitnessed, but yeah, it's important. Again, distal tibial metaphysis will be involved. It's a spiral fracture line which will be seen in the distal tibia, which is seen in the X-ray. Okay, the child will cry. The child will refuse to walk, refusal to bear the weight. The child will say that I can't bear the weight because it's a spiral fracture, and we have to give the above knee cast for approximately 3 weeks. So 3 is also something which is going to start from THREE, so T is going to be 3, and from 3 you can remember knee, so remember above cast which can be given to these patients. So this was a small little video to let you know all about the pediatric fractures, and I thank you for joining this session. Thank you.